Ever wondered what makes your jaw move, chew, and speak? Welcome to the world of the mandible, the strongest and most prominent bone of your lower face. From holding your teeth in place to playing a crucial role in your facial structure, the mandible is more than just a bone. It's a marvel of human anatomy. In this video, we're diving deep into the secrets of the mandible, its anatomy, its functions, and why it's so essential to everything we do. Whether you're a student, a professional, or just a curious mind, stay tuned as we uncover fascinating facts and expert insights about this amazing bone. Key features and anatomical relations. The mandible, or lower jaw bone, is a single, large, U-shaped bone found along the anteroinferior aspect of the cranium. It is classified as an irregular bone, lodges the mandibular lower teeth, and contributes to the formation of the viscerocranium. Articulates with temporal bones, arterial supply, inferior alveolar, sublingual, and submental arteries. Parts of mandible. 1. The alveolar part. Alveolar process is the thick, U-shaped, superior projection found along the superior aspect of the mandible. Provides an origin site for the buccinator muscle. The alveolar part of the mandible forms the mandibular alveolar arch, which lodges all of the mandibular lower teeth. 2. The body of mandible. Mandibular body is the horizontal, U-shaped, centrally located part of the bone. It is continuous superiorly with the alveolar process and continuous posterolaterally with both the right and left rami of the mandible. It consists of internal and external surfaces and a base. 3. The condylar processes. Condyloid processes are the two articular, posterosuperiorly located projections found along the superior aspect of the mandible. Provides an insertion site for a lateral pterygoid muscle and an attachment site for the lateral ligament of a temporomandibular joint. Contributes to the formation of a temporomandibular joint, along with a mandibular fossa of temporal bone and an intervening articular disc of temporomandibular joint. 4. The coronoid processes are the two triangular, anterosuperiorly located projections found along the superior aspect of the mandible. Provides an insertion site for a temporalis muscle. 5. The rami of mandible. Mandibular rami are the two vertical, quadrilateral, posterolaterally located parts of the mandible. Each ramus extends posterosuperiorly from the posterior ends of the body of the mandible. 6. The inferior alveolar foramen. Mandibular foramen is a small, irregularly shaped opening found along the medial surface of each ramus of the mandible. Each inferior alveolar foramen is located posterior to a lingula of the mandible and superior to the mylohyoid groove. It forms the internal opening of the mandibular canal. The inferior alveolar foramen allows for the passage of the inferior alveolar artery, vein, and nerve. 7. The mental foramen is a small, round opening found on the external surface of the body of the mandible, inferior to the mandibular premolar teeth. It forms the external opening of a mandibular canal. The mental foramen allows for the passage of the mental branch of the inferior alveolar artery, mental vein, and mental nerve. Surfaces of mandible. 1. The angles of mandible. Mandibular angles, or gonial angles, are the two corners found along the posteroinferior aspects of both the right and left rami of the mandible. Provides an insertion site for the masseter and medial pterygoid muscles. Provides an attachment site for the stylomandibular ligament. 2. The anterior borders. Anterior margins are the margins found along the frontal aspects of both the right and left rami of the mandible. Provides an insertion site for a temporalis muscle. 3. The base inferior border, or inferior margin, is the thick lower margin of the body of the mandible. Provides origin sites for the anterior bellies of both the right and left digastric muscles. Provides an insertion site for the platysma muscle. 4. The external surface is the convex area found along the outer aspect of the body of the mandible. It is one of two surfaces of the body of the mandible, the other being the internal surface. The external surface consists of the mental foramen, mental protuberance, mental tubercle, and the oblique line of the mandible. It provides origin sites for the depressor anguli, oris, and depressor labii inferioris muscles. 5. The internal surface is the concave area found along the inner aspect of the body of the mandible. It is one of two surfaces of the body of the mandible, the other being the external surface. The internal surface consists of the mylohyoid line, sublingual fossa, submandibular fossa, and the superior and inferior mental spines. It provides origin sites for the mylohyoid, geniohyoid, and genioglossus muscles. 6. The lateral surfaces are the two areas found along the outer aspects of both the right and left rami of the mandible. Each lateral surface provides an insertion site for the masseter muscle on its corresponding side. 7. The mandibular condyles heads of mandible are the two expanded, articular, superior ends of the condylar processes of the mandible. Contributes to the formation of a temporomandibular joint, along with a mandibular fossa of the temporal bone and an intervening articular disc of temporomandibular joint. 8. The medial surfaces are the two areas found along the inner aspects of both the right and left rami of the mandible. On its corresponding side, each medial surface consists of a mandibular foramen, mylohyoid groove, lingula, retromolar fossa, and a temporal crest. Provides an insertion site for the medial pterygoid muscle. Provides an attachment site for the sphenomandibular ligament. Forms the lateral wall of the infratemporal fossa. 9. The necks of the mandible condylar necks are the two constricted, inferior ends of the condylar processes of the mandible. On its corresponding side, each neck of mandible is continuous superiorly with a mandibular condyle and continuous inferiorly with a ramus of mandibles. Consists of a pterygoid fovea. Provides an insertion site for a lateral pterygoid muscle and an attachment site for the lateral ligament of a temporomandibular joint. 10. The posterior borders posterior margins are the thick margins found along the dorsal aspects of both the right and left rami of the mandible. On its corresponding side, each posterior border extends inferiorly from the condylar process to the angle of the mandible. Landmarks. 1. The dental alveoli alveolar cavities, or tooth sockets, are the small cavities found along the superior aspect of the alveolar process of the mandible. They lodge the roots of teeth and can vary in morphology depending on the type of tooth they each accommodate. In adults, there are normally 16 dental alveoli on the mandible. Adjacent dental alveoli are separated from each other by interalveolar septa, and the dental alveoli for some teeth are subdivided by interradicular septa in order to accommodate teeth that have more than one root. 2. The digastric fossae are the two rough, shallow depressions found along the base of the mandible. On its corresponding side, each digastric fossa provides an origin site for the anterior belly of a digastric muscle. 3. The inferior mental spine inferior genial spine, or inferior genial tubercle, is a small midline process found along the internal surface of the body of the mandible. It is the lower of the two mental spines that are found along the lower portion of the mandibular symphysis, the other being the superior mental spine. The inferior mental spine provides an origin site for both the right and left geniohyoid muscles. In some individuals, the inferior mental spine may be split and present as a pair of inferior mental spines. 4. The interalveolar septa are the small partitions found along the superior aspect of the alveolar process of the mandible. They separate adjacent dental alveoli tooth sockets. 5. The interradicular septa are the small partitions found in some dental alveoli tooth sockets. They subdivide dental alveoli into smaller cavities in order to accommodate teeth that have more than one root. 6. The lingulae of mandible are the two small projections found along the medial surfaces of each ramus of the mandible. On its corresponding side, each lingula of mandibles extends from the anterior margin of a mandibular foramen, provides an attachment site for a sphenomandibular ligament. 7. The mandibular notches, sigmoid notches, are the two deep indentations found along the posterosuperior aspects of the mandible. On its corresponding side, each mandibular notch travels anteriorly from a condylar process to a coronoid process of the mandible, allows for the passage of the masseteric nerve and vessels. 8. The mandibular symphysis, mental symphysis, or symphysis menti, is the vertical, sometimes indistinct, line found along the midline on the body of the mandible. It marks the site of fusion between the right and left halves of the mandible that unite during its development. On the external surface of the body of the mandible, the lower portion of the mandibular symphysis is continuous inferiorly with the mental protuberance. On the internal surface of the body of the mandible, the superior and inferior mental spines are found along the lower portion of the mandibular symphysis. 9. The mental protuberance is the triangular, midline elevation found along the external surface of the body of the mandible. It contributes to the formation of the prominence of the chin and is continuous, superiorly with the mandibular symphysis, laterally with the mental tubercles. 10. The mental tubercles are the two small prominences found along the external surface of the body of the mandible. Each mental tubercle contributes to the formation of the prominence of the chin and is continuous medially with the mental protuberance. 11. The mylohyoid grooves, mylohyoid sulci, are the two oblique depressions found along the medial surfaces of each ramus of the mandible. On its corresponding side, each mylohyoid groove extends antero-inferiorly from a mandibular foramen, is located posterior to a mylohyoid line, lodges a nerve to mylohyoid muscle and mylohyoid branches of inferior alveolar vessels. 12. The mylohyoid line's internal oblique ridges are the two oblique ridges found along the internal surface of the body of the mandible. On its corresponding side, each mylohyoid line extends antero-inferiorly from the area that lies postero-inferior to the third molar tooth towards the lower portion of the mandibular symphysis, although its posterior end is more distinct than its anterior end, is located superior to the submandibular fossa, inferior to the sublingual fossa, and anterior to the mylohyoid groove. Provides an origin site for the mylohyoid muscle. 13. The oblique line's external oblique ridges are the two ridges found along the external surface of the body of the mandible. Forms the lateral boundary of a retromolar fossa. Provides an origin site for the depressor anguli, oris muscle. 14. The pterygoid foveae, pterygoid pits, are the two small, shallow depressions found along the anterior aspect of each neck of the mandible. On its corresponding side, each pterygoid fovea provides an insertion site for a lateral pterygoid muscle. 15. The retromolar foci-retromolar area are the two shallow, triangular depressions found along the medial surfaces of each ramus of the mandible. On its corresponding side, each retromolar fossa. 16. The sublingual fossae are the two shallow depressions found along the internal surface of the body of the mandible. On its corresponding side, each sublingual fossa is located superior to the anterior portion of a mylohyoid line and lodges a sublingual gland. 17. The submandibular fossae are the two shallow depressions found along the internal surface of the body of the mandible. On its corresponding side, each submandibular fossa is located inferior to a mylohyoid line and lodges a submandibular gland. 18. The superior mental spine superior genial spine, or superior genial tubercle, is a small midline process found along the internal surface of the body of the mandible. It is the upper of the two mental spines that are found along the lower portion of the mandibular symphysis, the other being the inferior mental spine. The superior mental spine provides an origin site for the genioglossus muscle. In some individuals, the superior mental spine may be split and present as a pair of superior mental spines. 19. The temporal crests are the two ridges found along the posteromedial aspects of the mandible. On its corresponding side, each temporal crest extends anteroinferiorly from a coronoid process to the area located posterior to a third molar tooth, forms the medial boundary of a retromolar fossa, provides an insertion site for a temporalis muscle. Ossification. Ossification of the mandible occurs at multiple ossification centers. These are found in the right and left halves of the mandible, which appear in utero during the second month. Right and left condylar processes, which appear in utero later. Right and left coronoid processes, which appear in utero later. Mental protuberance, which appears in utero during the 7th month. The ossification center for the right and left halves of mandible form the right and left halves of its body and rami on its corresponding sides. Each half fuses with the condylar and coronoid processes on their same sides before birth. At birth, the right and left halves of the mandible remains unfused, with a mandibular symphysis located between them. They fuse with each other during the first 2/3 years after birth. The mental protuberances fuse with the rest of the mandible during the first year after birth. Variations. In each individual, the shape and size of the mandible changes with age ... in some individuals. Accessory mental foramina may be present. The coronoid processes may be present in an elongated form. A bony outgrowth may be present along the internal surface of the body of the mandible, known as a torus mandibularis. The mandible also displays sexual dimorphism. In males, the mandible tends to be larger and more robust than in females. The chin is squarer, the mandibular condyles are larger, and the sites of muscle attachment tend to be more pronounced than in females. Surface anatomy. Regarding surface anatomy, the body, rami, mental protuberances, and the alveolar, condylar, and condyloid processes can all be palpated. List of clinical correlates. Fracture of mandible. Dislocation of mandible. Temporomandibular joint dysfunction. Micrognathism. Macrognathism. Hyperplasia of coronoid process. Hyperplasia of condylar process. Craniometrics. 1. The condylion laterale is a craniometric point found along the lateral aspect of the cranium. It is the most lateral portion of the condylar process of mandible. 2. The condyle mediale is a craniometric point found along the medial aspect of the mandible. It is the most medial portion of the condylar process of mandible. 3. The coronion is a craniometric point found along the lateral aspect of the cranium. It is located at the most superior tip of the coronoid process of mandible. 4. The gnathion is a craniometric point found along the midline on the anterior aspect of the cranium. It is the most inferior midline portion of the mandible. 5. The gonion is a craniometric point found along the lateral aspect of the cranium. It is located at the most lateral portion of the angle of the mandible. 6. The pogonion is a craniometric point found along the midline on the anterior aspect of the cranium. It is the most anterior midline portion of the mandible. If you found this video helpful, make sure to hit the like button and subscribe for more insightful content on dental health. Got questions about the mandible? Drop them in the comments below and I'll be sure to answer them. Also, don't forget to check out our other videos on dental anatomy and care. Keep smiling and stay informed.